An experience I had while working as a nursing assistant at Leahy Clinic was sitting for a middle-aged woman that had fallen and was unable to respond to questions when brought to the hospital the day before. In report, the nursing assistant told me that she was confused and did not remember how she got to the hospital and thought that there was no reason for her to be there any longer. She mentioned to me that the patient had a diagnosis of schizophrenia and had attempted to leave her room several times that morning. She said that she was getting increasingly agitated. After hearing report, I was anxious and fearful to sit with this patient because I had a feeling it would be difficult to convince her to stay. I went into the morning with a negative mindset and my feelings were affirmed when the patient ripped her IV out 15 minutes into the shift. I tried my best to remain calm and to remind the patient that the IV and the Foley catheter were in place for her safety, and due to the fact that she was unresponsive when she came into the emergency room. Additionally, I kept reminding the patient that if she pulled the Foley catheter out, there would be a lot of bleeding and she would experience pain. I found myself getting increasingly frustrated as the patient ignored everything I was saying and took the IV out anyway, and tried to rip the Foley out several times. I called for help after the patient took her IV out and observed as the nurse attempted to calm the patient down. I felt like I was in over my head and could not think of what to say to make the patient calm down and stay in the room. After a few hours, the patient ended up leaving against medical advice, and I felt defeated because I knew there was more I could have done. After gaining knowledge through situations in clinical and through the presentation on trauma we had in class, there are a few things I would do differently if I were to experience this situation again. Dr. Chandler's PowerPoint on trauma-informed care touches on the topic of adverse childhood events and how the more ACEs you have experienced directly correlates to an increase in trauma. The patient mentioned that she was not close with her parents, had a tough upbringing, and lives paycheck to paycheck. Additionally, the patient has a diagnosis of schizophrenia, which puts her at a greater risk for experiencing trauma. According to the PowerPoint, unfamiliar locations, being stared at, and not having control are some of the triggers that cause patients to go into crisis. I have a better understanding of why the patient acted the way she did, because she had a one-to-one with her constantly, and she did not remember how she got to the hospital. She was in an unfamiliar setting and got a Foley catheter and IV placed in her arm while she was unconscious, so she had no control over those decisions. The patient responded to these triggers by being restless and trying to gain some sense of control in her life. As stated in Hall's pilot study conducted in 2016, nurses found that they were able to use less restraint on their patients when they engaged their patients in the process and encouraged them to work with the nurses rather than viewing them as people working against them. I should have expressed to the patient that I want to see her get better and be able to leave the hospital as soon as possible, but that requires that we work together. One thing I could have done differently from the start was going into the shift with a positive mindset because the patient can sense what kind of mood the staff is in. Additionally, in the future, I will ask the patient to recall how they got to the hospital and their feelings about being there so that I can understand their feelings about the situation and their readiness to get better. Lastly, I will ask the patient what things we could do for her to make her more comfortable.